like a small cut there you can see. When the heart is pumping, suddenly there's a tear in the aorta and blood enters into the different layers and separates. So the wall becomes very thin and it can rupture. The video is not moving, no? What's happening in the video? Now, what happens is sometimes it could be dangerous. If it ruptures because the wall is very thin, patient may not reach the hospital. If it is in between, blood is between the layers, means it will take some time for the patient to become serious. Before that, if you treat, patient will become alright. This is what happens actually. What I was mentioning about is this story. So this is the layers of the aorta. You can see outer layer, inner layer, and the blood just goes from the inner layer to the outer layer. That is called a dissection. Normally, when patient comes with a dissection, this part is involved and all this part are involved. But when the operation, normal cases, people will do this operation only in this part because tackling all these areas is very, very difficult. That is what the specialty of this case. We have tackled all these areas together. Because if you do this operation first, within a few years, patient may require correction of all these areas. And this is a classical example of what operation is done by most of the places where they are in a dissection. When it occurs here, you just replace this part and this area is not attended. And if you don't attend, this is what happens. The aneurysm keep on increasing, and these are the patients which I have operated, which have been referred from different centers where this part is not tackled. So you can understand what happens. With only this area they have tackled in all these cases. So patients compared with another sometimes second operation or even third operation. Now this particular graft which we got, we are just showing how we do this procedure. It's called a Thoraflex hybrid graft. This is an animation of the graft where we stop the heart, cool the blood to about 25 degrees, and this is the graft being deployed into this part of the aorta. You can see this graft. That is the lower part which goes inside and then fixes all the tear inside this aorta, lower part of the aorta. So all this procedure is done when the heart is stopped, the blood supply to the lower part of the body also is stopped. Only the brain is getting blood which is at a temperature of about 24 degrees. And you can see, so I showed you the tear in the previous picture, it's all being covered here. Totally we cover, and then with this part, the remaining part of the graft, we replace the arch of the aorta. You can see that the branches of the graft which supply, this goes to the left side of the left hand, this goes to the brain, and now the end of the graft will connect it to the heart. That is how it looks once it is removed. It's just an animation, only looks very simple here, but it is not that easy when you are when the heart is arrested and we have to keep the timing. We cannot have too much time to do the operation. So we have to take one of the problems in an acute emergency is these tissues are all very, very weak. It will not hold the stitches. All these areas can leak and you may require a lot of blood and all those things. Sometimes it will be very hard to stop the bleeding. One of the complications of this operation is uncontrollable bleeding when the tissues are very weak. Now this is the patient which we came to us. Actually, he had chest pain in the abdomen, in the stomach. It was in Coimbatore, and they could not diagnose it initially. So initially, and he could not move his leg. He had problem in walking and pain. So they did a scan only of the lower part of the body. So the moment they told me then from Coimbatore that the patient was referred here. And when I heard the history itself, I told them to do a CT scan immediately because the history is very typical. Somebody having pain and not able to move the leg with the absent pulses. So when we did, we found there is a dissection. You can see this is exactly the picture when the patient came in. Only there's a slit only. Blood coming out of the heart is almost blocked here. The valve was leaking and there was a tear in this aorta there. So we immediately took the patient to the operating theatre and then we did the surgery. I'll just show you the so you can see the color of the aorta. That is what it was. You could see that. See, this is how it looks like. See that the whole blood outside. In the picture I have shown all the branches. You can see it in the real picture in the video. So through this we deploy the graft where there is tear in the lower part, in the chest. You cannot see that part. It's pass a wire, through that only we get the graft. This all this has to be stitched very, very carefully because even one needle hole leaks can kill the patient of bleeding. So it's a very, very extremely delicate procedure. All this has to be very, very meticulously done. Now we will pass that graft inside. Yeah, that is the animation I showed. This is the graft which is being used in this country for the first time. It's called a Thoraflex graft. Made by a company called Terumo from Japan. Now this goes into the lower part where you saw the tear in the aorta and it will fix that. All these are branches of graft which has to connect the blood vessels going into the upper half of the body, to the brain and the upper limbs. This is being stitched to control the bleeding. You can see blood leaking through that. Now the circulation to the lower part we have restarted. Normally you take about nearly 30 to 40 minutes to do this procedure. And during that time, there is no blood flow in the lower part of the body. But once you cool the blood, all the organs like kidney, liver, intestine, stomach, everything will be protected. So now we are starting the blood flow through this graft. That is why the blood is leaking. So we have to stop all the bleeding there. You can see it's all dry. As you take more stitches, because even a small needle hole sometimes can leak. The tissues are so friable. And we are starting circulation through this tube into the lower part. That is what you are seeing now. Connecting the tube. So we start the blood flow. The blood is coming back once you. That is from the heart-lung machine. We are shaking the patient to get the air out from the graft so that air will not go to the brain. Now lower body circulation is maintained from the pump through this tube, and we are connecting the blood vessels to the upper limb and the brain while the suturing is going on. We release the clamp, blood will flow through there. And the needle is poked to remove air. After that, we connect this on to the heart because the heart is not getting any blood. Now, once the tube is connected, the heart will start beating. Stitches in the upper part of the graft onto the lower part of the aorta. After this, we slowly warm the blood. Temperature which is 24 degrees now slowly will come down. You can see the heart start beating once warm blood goes into the heart. And now one by one we connect the blood vessels going to the brain. And at the end of the procedure, we disconnect the patient from the heart-lung machine. This is the last anastomosis we call. This connection of this graft to the blood vessel going to the right side of the brain. The left side is already connected now. This blood vessel supply is connected. So that is the end of the operation.